Do you use a lot of technology devices, computer screens, tablets, phones, smartphones, anything of that nature? We're going to be talking about blue light in this video and the effects it can have on the eyes. So, what is blue light exactly? Blue light is part of the visible light spectrum, what you would see in the form of colors. And the nanometer wavelength typically ranges anywhere between 380 to 500 nanometers. So it's a pretty short wavelength that emits a high amount of intense energy when emitted from sources, whether it's from the sun in the form of visible light or from devices like your computer or your phone or your tablet or anything in that nature. It can cause a lot of issues to the eyes, but there can be some benefits as well too. We're going to talk about those. Most TVs, most computer screens, most devices that have some level of technology in them usually emit some level of blue light, which can cause some issues to the eyes, known as the following. Over time, it can lead to issues like age-related macular degeneration. And according to a vision study by the National Eye Institute, children are more at risk than adults because they absorb more blue light from digital devices. They kind of have growing eyeballs and they're more susceptible to absorbing more things. According to the Vision Council, 80% of American adults use digital devices more than 2 hours per day. Nearly 67% use two or more devices at the same time. 59% have symptoms of digital eye strain. So, blue light can do a lot of things for the eyes as far as causing issues with sleep, messing with your circadian rhythm. It can cause you to not blink as much because you're trying to absorb a lot more information, which can lead to dry eye and digital vision strain. Other conditions you could develop as a result of too much blue light eventually over time can include type 2 diabetes, cardiovascular disease, cancer, sleep disorders, and cognitive dysfunctions. So there's a lot of negatives that can come with blue light, but what are some of the positives? Blue light can boost alertness, helps memory and brain function, and elevates the mood. It regulates your body's natural wake and sleep cycle, known as the circadian rhythm, and sunlight is also important for the growth and development of eyes and vision in children. So when we talk about blue light, you need a fine balance between getting too much, getting too little. You need somewhere in the middle. Now, a lot of people have gotten into what's called blue light blocker lenses or blue light blocker glasses. This can be a great tool to help filter the amount of blue light that's coming out of your digital devices if you cannot alter the display settings on your screens. Sometimes you can, whether it's phones, tablets, computers, TVs, you can actually decrease the amount of blue light that's coming out of the screens in certain display settings. I've worked with several patients that sometimes can't modify those settings, whether it has to do with their career, their lifestyle, or anything of that nature. And in this case, blue light blocking glasses would be significantly advantageous to those patients. But if you can modify the settings and not interfere with any of your work, your lifestyle, or anything like that, that can usually do the same effect as blue light blocking glasses because it actually is programmed within the device to emit less blue light coming out of the screen at your face. So there's a couple of things you can do in addition to the blue light blocking glasses, also known as the 20-20-20 rule. So every 20 minutes you're on your phone, on your computer, watching TV, or doing anything with blue light coming out of the screen, make sure you look at something about 20 feet away for about 20 seconds. This will kind of give your eyes a chance to reset and regenerate and to be able to continue working and doing what you've been working and doing. Setting up a good working distance will really help with that too. You don't want to be all up on the device, but you also don't want to be so far back that you can't really stay engaged with what's going on and you can't see what's in front of you. And make sure you talk to your eye doctor if you have any questions about blue light blocking glasses, what it does to the eyes, the harmful effects, the positive effects. All of that can be covered within your examination. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for more notifications. I'm Dr. Bryce Heffington, and we'll see you next time.